Pigmentation, especially melasma, which is something I do a ton of. I work a lot on patients for their skin conditions, especially I love to restore skin. So for some patients who have had lifelong pigmentation or pigmentation that occurred due to hormonal changes or due to genetics, such as melasma patients, we can do multiple different modalities, and one of the modalities that we could do to help them is actually lasers. And the lasers I do use tend to be low energy, low heat. So we're going to wait a few more moments for a lot more people to join us right now, and we'll go through just kind of what I do for pigmentation, especially something like melasma. You can see for this patient, for example, this is a patient who is of Hispanic origin, and we helped out her pigmentation quite a bit. So you can take a look and see that, for this patient, for her pigmentation, she was somebody who had tried a lot of different things. She had used topical creams for a long, long time. Nothing was really helping for her. She also was on hydroquinone for a short period of time as well, and for about 2-3 months, and nothing had really budged her pigmentation. So what I had to do was really a systematic approach to break up that pigmentation, and you could see actually over the course of a full year we still have beautiful results. Actually, we started in March of last year, and then I saw her now for just a regular follow-up, and I saw that her skin's just so clear, and she's letting us share it right now, so I appreciated that. But you can take a look and see, like, this is just what we do a lot with. Pigmentation is a big deal because I like to solve it for patients in general. It's something that doesn't get covered well with makeup, doesn't get covered well, even with concealers, and it can be really distressing for a lot of patients because it's like one day your skin was totally clear, and then one day something happened. It may not even been your fault. It could have just been due to pregnancy, things like that. And now we're looking at this, and that people were turned away constantly, saying that they can't do anything for their melasma in their skin type. And here I have result after result after result. We have really close to about 15,000 patients that we've done for melasma treatments, and it's worked incredibly well for their pigmentation. So this is, this particular patient is a Hispanic patient, and most of our patients for pigmentation are Hispanic actually, but we do all skin types though. Where are we located? We're in Newport Beach, California. So Flower Power saying thoughts on hyperdilute Radiesse. That's awesome. I love the fact that people are asking that more and more now. It's one of my favorite products. Actually, I did that today as well for a patient. She had a lot of hollowness in her jowl area. So in that area, we will have to be really careful. We don't want to use heavy fillers. It could actually end up weighing down the skin. You could actually get worse jowling in that case. So instead, what we ended up doing for her was what we actually did was hyperdilute Radiesse, which is a calcium-based product. We put it directly underneath the skin to stimulate collagen production, and something really important is elastin production. So we did that essentially to, over time, improve the skin and give you a little bit of a volume effect. So it's a really nice way of giving you some skin tightening, giving you some collagen, and giving some volume. So hyperdilute Radiesse we could do really anywhere. I've done it actually pretty much from head to toe, every single part of the body at this point. I've even done on someone's feet. Hands are really common actually. I've done on the elbow area as well. Knees, you could do it actually just pretty much anywhere. And just as long as you're diluting it in an appropriate way and you're making it so that it's something really relatively thin for the skin and doesn't get too thick there, you could you got really beautiful results. Actually, I'll show you some, since you're asking about that, I'll show you some results of hyperdilute Radiesse a little bit today. Let's see here. Kim Taylor saying, how about African American skin? Actually, I have a really amazing result for African American skin. I showcased that before, but I'll be happy to show that again tonight in just a little bit. I'll show you that. It's something I deal a lot with actually. There's a way to do it. You can still use certain lasers. I wouldn't use a lot of different lasers for African skin. But there's a way to do it, and you could do it safely. Today, actually, I had a patient. She had very, very severe stretch marks on her legs. She had a lot of weight loss, and she was really, really concerned. She's of African descent. I did actually have to do something where I used an erbium laser for her, and then we're going to then use dilute radius. So we're going to do that for her stretch marks. But there's a way to do it even in African skin. So, I'm okay with people saying that they can't treat skin of color, but I don't like it when people say you cannot treat skin of color, if that makes sense. So meaning I'm okay if the practitioner admits that this is something they're not particularly comfortable with, it's not something that they've done too much of, but I don't like it when people try to make it seem as if there's no way of treating skin of color, because there is a way. You certainly can treat it. It's just that you have to be really safe when you're doing skin of color, and a lot of different things have to be involved. It's not usually just the laser or energy devices. Sometimes you have to use other modalities. For example, for melasma patients, really the biggest thing is going to be sunblock. I also can sometimes do things like oral or topical tranexamic acid. That's another option for patients. You do need things to really block the pigmentation. Typically, I don't do too much with hydroquinone in general. And in fact, this patient didn't do hydroquinone, but sometimes we may need that as well. So it sort of depends on what we're looking at. And if there's some vessels that are underneath the pigmentation, which is pretty common with melasma, we may sometimes use like a vascular laser like the XLV. So I use a Pico laser and I use the XLV laser sometimes. Joey's saying it's choppy. So if anybody else is saying it's choppy, I'll be happy to see what's going on there, and maybe I could try to change it. Let's see. Flower Power is saying, is Luminous M22 IPL for Fits 4 the safer option compared to other IPL devices? It's a good device, actually. I do like that for certain skin conditions. But I've said before that for melasma, I don't love IPL really at all. I do think that it's pretty concerning, actually, for the fact that some people are pushed with hyperpigmentation, like this particular patient. She could have been pushed for lasers or energy devices that were not appropriate. And IPL is actually one of the riskiest procedures, especially for skin of color and with melasma patients. So I wouldn't recommend doing it that way. But I do like Pico lasers, especially the way I do it. I have two different kinds of Pico lasers. I have one wavelength that goes a little bit deeper, and then I have another that goes really shallow. One's called Pico Cure and one's called Pico Sure. I wouldn't get too bogged down in different names, but the Pico Sure is really the only one that has this 755 wavelength, which works very, very well for melasma patients. The only thing is that it could sometimes be a little bit too hot for certain patients. So I usually don't use that particular wavelength for African skin type. But most patients, including even darker Hispanic patients, we could do it on there. But that's the thing. So I'm not bound to any company for me. So I use pretty much any different company as long as it's the best possible product and the best possible device for the patient. And I like that. I like just being a free agent with this stuff and just kind of just going, okay, this particular laser is the best laser for this patient. I don't care what company makes it. That company could be making only one laser that's really, really great, and that's the laser I'm going to get. And if it's helpful for this patient, I'm going to use that for that particular patient. And then even if it ended up costing me more for another laser device, it's fine. I'll do that because I want to treat another kind of skin type. So sometimes I actually just have certain devices that are really just for certain skin type. I don't even use them at all for other skin types, just to be honest with you. Like I have like 27 different lasers. I love lasers, and I am a real big believer in not using something that's just a multi-platform system that just could do a bunch of stuff. I found really, really early on that these jack of all trades things just don't help out too much. In fact, I had one time I had a device that wasn't very good, and then the laser company ultimately, with a long negotiation, they changed it with another device, which is sort of like their flagship, something that had a whole bunch of modalities on there. And I thought the device was really terrible, to be frank. I thought it was really sad, the fact that they had so many different hand pieces and nothing was good. It was like a bunch of different hand pieces, and it was like nothing was excellent. So that's sort of how I think. I do things. You guys know I just try to focus on a few things. Things I showcase for you guys. It's like I do a lot with, and there's a reason why I do a lot with it, because I think that you have to do a lot in order to be really, really great at it. And if you kind of just bounce around and don't focus too much on one particular subject, you could actually end up basically, not being great at anything. Vincent saying, hey, I got my nose job in bed resting and I did my chin. Awesome, Vincent. So Vincent got rhinoplasty and then he got a chin implant. Awesome. I'm good. I'm looking forward to seeing you, Vincent, soon when you recover. That'll be awesome. See Chan saying, hi doc, do you think you can use lasers to remove little bumps under the skin? Not sure if it's closed comedones or small cysts, but just some textural differences from the rest of the face. Yeah, I love doing that. Actually, I do it all the time. At some point, I'm going to try to film some more of those, but they're usually pretty fast little procedures. I just go in there and just do it actually. So, but I do a lot of that actually. I do a lot with those. Today, I actually burned off a few AKs too, which is really, really cool too. So sometimes it's really fun. But you know, I'll show some more of those things here too. What's my thought on erbium reverse? I'm not sure what erbium reverse is. I never heard of that before. What about Pico Sure laser? Pico Sure is awesome. Honestly, I love Pico Sure. What I was talking about before though is that it's, so the thing that is really the Pico Sure's calling card is the fact that it has something called a 755 wavelength, which is very, very great for melanocytes. It's excellent for that. The only thing is that it could generate a little bit more heat than something that is basically a 1064 wavelength. So things like Pico Care is one thing I use, or Pico Way is another company that also is a device that's 1064. Those ones are a little bit deeper. They tend not to have as much heat as the Pico Sure. So that means for some patients with melasma, we may not necessarily want to use the Pico Sure because it could end up generating too much heat for that particular patient, especially in darker skin types. So a lot of times I don't use a Pico Sure right off the bat for darker skin types, and especially really for African patients, I'm very, very hesitant to use that. You could get more rebound pigmentation, and also you could even get hypopigmentation. So there's ways of doing this to avoid that problem, but it's something I pay attention to a lot. And I, you know, none of my patients, when I do melasma treatments, they're not ending up worse. I always make them better. So it's like really, really important for me. It's something I pride myself a lot on, to be honest with you. I started a lot with my practice on focusing with pigmentation. Because it just was something that I just saw like was really bothersome for a lot of patients, really, really problematic. And it was something that people are turned away from a lot. You know, now people have accepted that we could use laser and energy devices, but believe me, you know, 7 years ago when I was doing a lot of this stuff, it was like every single time I put the stuff up there, the comments were just like full of it, of people saying that you can't use lasers in darker skin types, you can't use lasers for melasma. It was just like full of that. And it was just like this constant barrier that I was facing, that people were just feeling like you can't do this, and they heard from so many people that you can't do this. And here's another way we could do it. Here, you know, we have a beautiful result showcasing it, and I want to show you another angle from this, just because it's like it's really, really nice. You could just see really life-changing in this particular patient, like just beaming, so happy, so excited. She does do a great job, by the way, also, of course, with sunblock. And then she has, when she walked in, she has like a huge like hat as well, which is really, really nice. So it's like, those are things that really could push these results over the edge. So if you look at this here, I want to show you, look at how amazing that skin is. Look at that. Look at how good that skin is. That's really great skin. Look at that. So that's what we could do. I mean, it's like, this is something that a lot of people would say you can't do, you can't treat. I do want to emphasize there's still some pigmentation. You still do have a little bit of pigmentation. It's not gone completely. Melasma isn't a condition that is going to just be solved completely, but there's no question that it's significantly better. There's no question about that. So I don't think it's fair really for people to say that there's just no treatment. I mean, this is so important for the patients to be able to improve. Something like this at this level is really wonderful for them, because now they no longer have to suffer from the embarrassment of sometimes even having that pigmentation above the lip. Like that looks almost, for some patients have said that they've been told that there was like a mustache, things like that. That's really distressing for people. It's really concerning that, like, first of all, their friends even comment on it. I've also told people, it's part of this whole thing, by the way, this whole journey, sometimes I'm going to tell you that maybe you should just get new friends, to be honest with you. Because like I've never like sat there and I've looked at like a friend and thought, man, like why do you have like this problem on your face, and sort of like some people said they made fun of them before about it, things like that. It's like I literally have never thought that like in my like ever, and the vast majority of people have never thought that, and the patients that I've said like are shocked that their friends say that too. It's like honestly part of sometimes some of this is just like get a new friend group, partially too. Like we're gonna help you out, I'm gonna make you feel better about yourself. I want you to feel really, really good about yourself, but like maybe like your friends aren't the best people, honestly, and like maybe this is like a test for it, and you can kind of just see in life that these are people you probably should start cutting out, because if they're like commenting on this stuff, I have people that like say that they're coworkers make fun of it and stuff like that. It's like, you know, maybe it's like time to like figure something else out, because this is just like, it's totally inappropriate for people to be commenting stuff like that. You know, so that's at least my take on this stuff, because it's like, I feel like I never thought about it. I've never, like, it's never even crossed my mind. I can't even imagine like it's sitting there like thinking like, oh, my friend has like a pimple that I'm just going to comment on and like and be aggressive about or anything like that. It's just like wild. In fact, I would be like, you know, it gets better. Don't worry. There's ways that it's going to improve it, things like that. If they brought it up, but like it certainly wouldn't be something that like I'd be like pointing at and like and asking what's wrong with you and why aren't you doing anything about that? That's just so terrible. And some people would be there like, oh, I don't see a difference, things like that. Sharpie saying totally same here, so rude. Yeah, and actually I had a patient like last week, a beautiful result. She herself was so happy, and she's just talking about how her husband was talking about how he didn't see any results and was unhappy. And you know, she was like, you know, I see the results, but like I don't know, I have to see, can you show me the photos, because I need to show it to my husband to prove to him that the results are great. And it's like so sad to me that like he's just like sitting there and like, you know, you're happy that, you know, she's like really, really excited and happy about everything. And like, he's just like making it seem like, oh, you just wasted your money, blah, 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 blah. I don't see any results. And, you know, I don't know, like, I'm not saying like, get a new husband, although maybe that's part of it, but like, you know, probably like something has to be like, some sort of discussion has to happen about why your husband's kind of making these kind of statements and putting you down like that. I don't understand it really. It's like, and still commenting about like, and sometimes you'll have someone that's there and like make like that comments that kind of stuff. It's like really unfortunate, very rare, but every once in a while it happens, you know. It's really, it's really unfortunate. Mario saying, is melasma hormone driven? Yes, it definitely could be. So part of it, you know, is because of hormonal changes. A lot of times you may have heard it called like a pregnancy mask. So occasionally it could occur when patients are pregnant, and everything was clear, and then they ended up getting pregnant, and essentially that estrogen ended up causing a lot of times the excess blood flow to these spots. And so this is different than typical hyperpigmentation. There is more of like this vascular component to it. There's this tortuous component of these vessels that sometimes we have to slow down. We could slow that down with lasers, or we could also do it with oral medications or topical creams. So there's certain things that we may have to do for the blood vessels or lasers. Like I said, like I use a Pico laser, but sometimes also for those little red vessels, we could even use XLV, works very, very well. Some people would use V-beam, but there's a little bit more heat with that. So at least for now, I believe they're just coming up with a new one soon. But at this point, I would say it's a little bit too much heat, especially for darker skin types. And there's another device, it's called DermaV. I haven't really played around with that particular one, but that's supposed to also be potentially okay. Although I have heard from other practitioners that XLV has better contact cooling than that. So that's why I tend to use that even in darker skin types, even with melasma patients. Really low risk for me with the way I do it for causing more pigmentation that way. Let's see here. Jess saying, is there a risk for the melasma to get worse due to the heat? Yeah, absolutely. You know, this year I had a lot of patients coming in for melasma treatments, a lot. And we are very, very busy for melasma, but this year exceptionally busy, partly because it was like 108 degrees and people were doing really well otherwise. And then they ended up, you know, it came out with the 108 degrees. So imagine you're putting so much sunblock on, everything else under control, but then you go to your car, you know, and now just that little bit of heat, or just you're in your car and it's super hot. And it's like, gosh, it's you know, one time I was actually in like Scottsdale, Arizona for a conference like years and years ago. And I was like, man, Scottsdale is beautiful. It's really nice. I came in, I flew in at nighttime. And then the next day I was going to my rental car, and like honestly, I almost burned my hand. It was so hot, and the car itself was super hot. So I can't imagine, like for some patients, like how difficult it must be to manage pigmentation like this in that kind of weather. Like you know, it was probably like 115 to 100. And then I was asking everybody over there. They're all saying it's like this was nothing for them. I don't know anybody's from Scottsdale over there, but like it was really hot when I was over there. At one point, I almost went to Scottsdale, just so you guys know. You guys would have seen, like I would have all said, like introduced myself as coming from Scottsdale, because I really liked it. I was like, this city's like beautiful, it's amazing. And I'm from Chicago, and they have like a bunch of like Chicago restaurants. They had like Portillo's, they had Potbellies, they had a bunch of stuff there. So I was like, this place is awesome. And then I was like, it was so hot. Let's see here. So where's this? I know I missed a bunch of things. Pune is saying, is it okay to use LED red light with melasma? Would not recommend it. That heat is not going to be great for melasma. Other patients is going to be fine, but for melasma patients, I would not recommend it. Let's see here. What do you recommend that aren't fillers for nasolabial folds? So there's not too many options, honestly, for NLF. Sometimes you could do threads if it's really, really heavy or skin, thicker skin, you may do that. But even that's not gonna be the best option. Honestly, fillers with like Bellafill especially works really, really well. Incredibly, like exceptionally well. A patient of mine came in today, I saw her like 2 years ago or so, and did some Bellafill. She was asking if I need to do more for any other areas. It's like, your nerd and smile line's perfect. So we ended up not having to do any more with it. It's just like, it's so great, it lasts, it continues to make your skin quality better. Really fun product for patients, especially in that area. Cal Ray is coming from Malaysia. Cal Ray is saying, hi doctor, it was nice talking to you just now. How much is it for the laser that removes bumps under the skin? Cal Ray, I'll have my team give you an estimate for that. We'll take a look at those bumps because we didn't talk about that. But we'll be happy to see it. Cal Ray is going to come in from Malaysia. Malaysia, by the way, I've been to Malaysia. Really beautiful country, actually. Really good food, really, really nice. Fantasy Girl is saying, I need to make an appointment with you. Appreciate you. So what you could do is just go to my page, just go click on the link on our profile, and then you can just book a consultation directly through there. We just have a bunch of things you could check out right there. Just like that, we'll help you out with that. Let's see here. Candle saying, CO2 gave my brother severe fat loss. What do you suggest for those who are scared of lasers again? Well, that's interesting that you're saying that it gave severe fat loss from CO2. Was there anything else? Sometimes if there's like radio frequency microneedling, I could see that, but it would be really difficult for me to see it with CO2 by itself. I'm not saying it's impossible, but they would really have to burn down the skin, like really like high energy for that to be able to happen. And it seems like you'll probably have other catastrophic issues then. Maybe they use something else though. Let's see here. I would like a consultation. Appreciate you, Kim. Just go through my profile. We'll help you out with that there. Just go through that. Let's see here. Why would you recommend laser treatment knowing the melasma most likely comes back? So we actually have a very, very low incidence of recurrence at my practice. My patients do exceptionally well, mostly with doing the laser kind of periodically throughout the year. And in general, what we end up doing is that we, of course, recommend a strong sunblock and some sort of tyrosine kinase inhibitor, so something really to suppress that pigmentation. It doesn't have to come back the way people think. It's just not true that it just has to come back. I know that there's people that just say things like that, like, oh, it's going to have to come back. This is going to always be the same. Just not true. It's just like I've been dealing with the patients for 7 years now who is just like great. And they don't even come to me for the melasma anymore. They come to me for like Botox or filler, other things. They're very, very happy, comfortable in their skin. It's like, it's very, very different from where I first saw them, exceptionally different. And in fact, it's not just that patient. Sometimes they'll bring their mothers, sometimes they'll bring their sisters, and you notice a lot of times I say female because this does a lot of times this is a condition that's more common with women than with men, and it's suppressed. Actually, there's ways to keep it under control. So it's not true that it just has to come back. Of course, you're going to have to wear sunblock. Of course, you're going to have to make sure that you're really careful with the sun. Of course, you're going to have to be careful with heat. But it's not true that it just has to come back the same way. It's just not true. You could suppress it. You could keep it under control. There's ways to do that. And I will help you with that. Kim is saying, do you do hair restoration as well? We do a lot with that. We do a ton with that. It actually literally took off so much more now. This year, everybody's trying to do hair restoration. We do so much with PRP. We made it very, very comfortable and affordable for patients now at this point. Just book it directly on our page. You can just go on and get PRP shots actually from us. Just do it monthly. The way we priced it out, it's so cheap. It's just on purpose that way. I just want people to just do it because I loved it. It's great for my skin. Well, great for my hair, I should say. And it was like, I was like, yeah, you know, this just should be something that more people just do more often, and just it's not much of a concern. So I actually pushed away more from the things that like everybody was pushing on here, which was things like you know, these like easy PRF and everything like that was out there. And I found that like regular PRP, just with a high platelet count that you could get with a really good centrifuge, gives you excellent results, and you don't have to like spend this like an enormous amount for this. And I want everybody to do it. I want everybody to do it because it's great for your skin. And just continue to, and I'm saying your skin, but really it's, I'm talking about your hair. It's really, really great for your hair. For your skin, it's good for healing properties. It's really, really good for that. You do get some more blood flow, especially underneath the eyes. Really great option for that. So you know, it just depends on what you're trying to solve. But for hair restoration, it works incredibly well. I think it's Khadija is saying, hi doc, I think I have rosacea. My nose and cheeks are red most of the time. What is your suggestion? Well, if it is really true rosacea, you probably should double check to see what you're using right now. So just kind of make it a lot simpler. I find Vanity cream to probably be one of the easiest creams to use for rosacea patients. Sometimes though, you have to do some sort of antibiotic or antimicrobial, something either topical or oral, but usually you want to prevent other triggers. So you don't want a chemical or physical exfoliants. Usually I find that physical sunblock is a little less irritating than chemical sunblocks also. So a few different things that we may want to take a look at to see if that will actually be helping rosacea. But we do a lot with rosacea with lasers. Once that's necessary, we'll help out with that. Moldy's saying, what is the best filler other than Belafil for acne scars, volume loss on cheeks? Sculptra is awesome. Radiesse is awesome. Even, if you want to do hyaluronic acid filler for just a fast, quick fix, we could do that as well. And I'll do it properly. I'll still do it properly. But I do really believe in collagen fillers. Does Clear and Brilliant work? It helps if you're like Fitzpatrick 1 through 3. So typically more like Northern European descent or European descent. That's probably where it's going to help a little bit, and more for like just sunspots. So I really wouldn't use it for melasma patients. I don't think it's helpful for melasma patients. I know that they push it for melasma patients. If you go through the results, I don't know if anybody has as many melasma results as me, to be honest with you, to be totally frank. Some of the people that really push, there was some guy, some doctor who was really wanting me, he was like a sales rep basically for one of the laser companies, and he was really insisting that I use this Q-switch laser for melasma. Is claiming that it's better than the Pico laser, and he had no results from melasma, none. And just recently, there was like a new result that he put up there, and it was like, poor lighting, and still wasn't even as clear as this. And so it's like, sometimes people are pushing these devices because they're paid for it. They're paid by them, really. That's the bottom line. That's the truth. And sometimes they're pushing it because it's like they're already bought some other device from that laser rep, and now they kind of had a bundle deal for another device, and it wasn't the best device for that particular condition and that patient. But they're pushing it because now they have to push it because they spent like $150,000 to $200,000 on their laser. So it's like now you're kind of stuck with like, what are you going to do? And you can't just sell it because lasers, like after like you got it, it's basically useless. So like it's like the price you may have paid for $200,000, and now it's worth like $30,000 just really rapidly. So it's like you just had a big loss on that now. So now a lot of people are just going to push it, and people got suckered in with a lot of different devices, and it's unfortunate. And they really there's a way of doing this that you could do really properly. It's just a matter of being like really committed to it. That's why I don't believe, like I said, I don't believe in jack of all trades. That's why I'm not a jack of all trades. I never say I just do everything. I'm not like, oh, I do a little bit of everything. I don't do a little bit of everything. I do a lot of a few things. That's what I do. I do exceptionally well with a few different things. I don't do a bunch of stuff. That's what I like to do, actually. Let's see here. What do you think of NuFace? I heard it can cause skin laxity. I guess I have to take a look at that. I'll play around and looking at that later on. Someone was asking about Legend Pro. I'm not sure what you're asking for, though. That's just a RF microneedling device, by the way. So I'll have to see what the NuFace thing is, though. Maybe if somebody wants to look at NuFace, I need to have one of those guys that like kind of types in like and searches for me in the middle of this, so we could take a look and see there what that could be. Ours is saying, I have some laxity under my eye. Should I do Morpheus or CO2 laser or both? Maybe, yeah, it could be. Morpheus 8 works really well for the under eye area for skin tightening. CO2 laser, depending on your skin type. Erbium laser is another option. It sort of depends, or just, of course, surgery, depending on what's going on there. RA is saying, can hydroquinone work for melasma? It could, but it's like sometimes it can cause more pigmentation issues. There's sometimes for patients, because melasma is more of a chronic condition, you could be on it for too long, and then you can get this grayish discoloration of your skin. A lot of patients, it happens actually, and it's really distressing when that happens, when you get this grayish discoloration. I actually have to show you some results. I'll try to see if one of the patients that I've had recently will let me share it. I'll double check. If she does, it'll be really cool. The only way to really help with that, I found, is with something like the Pico laser. Someone, by the way, I don't know if you're still on, you were asking about African skin tone. This is a patient, African skin tone, a patient I've been working on for like 7 years now. You can see with her pigmentation, really significant improvement there. But I'm not sure if you're still on, but if you are, that's African skin tone right there. So before I end for tonight, I'll kind of finish with that. Let's see, I know I finished at this point, I'm finishing right now, but if anybody has some pressing questions, I'll help you out here. What are your thoughts on the Hollywood laser peel? So we do the carbon peel all the time. It's awesome. It's a really, really nice pick me up, but it's not really going to solve like really like the full pigmentation like that. It's more like a nice exfoliant, help a little bit with pigmentation. But not quite like the full thing. So this patient, I wanted to explain, since you're here, so Kim, since you're here, I want to explain a little bit. So this patient, this is actually her natural skin tone. I know every time I post this, people get confused about this, but this is actually closer to her natural skin tone right here. And you could actually see, we actually could do something called a Woods lamp, and you could really see kind of closer to where the pigmentation is, the depth of the pigmentation. And also there's different ways that we could tell essentially sometimes where the normal natural skin tone is. And if you come in, I could go through it with you to show you really where your real skin color is. And try to get closer to your natural skin color as close as possible. Don't try to go and go lighter than that, just closer to just really what your real skin color is. And that's what we ended up getting for her. It's a really, really beautiful result. Over time, honestly, for her, it's like, if you look at it, again, this is about 7 years ago. She's actually, interestingly enough, when I first opened, she was one of like my own private practice. She was somebody who came in like a few months later. So I've been working with her for about 7 years now. And well, if you look at her right now, I mean, look at that. She looks younger today than she did when she came in, walked in through that door 7 years ago. It's really, really interesting. And she like had a vision of what she's supposed to look like and what she used to look like, and was really disturbed by the fact that her skin doesn't look the same. It doesn't look the way it was supposed to look. So it's really, really amazing to be able to get that, and just get that confidence for her, where she feels like she's just has achieved, what she was envisioning in her mind 7 years ago. It's awesome, and we've been able to maintain it. She's been able to keep it. People are saying, "Oh, it comes back." Pigmentation always comes back. Things like that. We could keep it. We could get it under control. And she's, of course, very, very good. Although she gardens a lot, she does a very, very good job of making sure that she wears a hat and a ton of sunblock. So that's we do all sorts of skin color. Well, every single type of skin I've dealt with and I've worked with, and we've done safely, and we've improved at this point. So it's something I do a ton of, and I love doing. Actually, it's really rewarding for me. It's especially I like hearing people tried a lot of things and it didn't work, and I'm like, I'm gonna be like your last point right now. I'm that final stop right now for you. And now we got there. Actually, another patient, she was on here earlier. I don't think she's still on though, but I'll show you her results actually if she's on here, but if I see her name here, but maybe tomorrow I'll see if she comes on. But actually, she's also a really wonderful patient, Hispanic origin, and she was somebody who had really thick melasma for a long, long time. It cleared it up incredibly well. She got to keep it. It's doable. It's achievable. We have to be patient too. In darker skin types, you do want to be really patient. You don't want to actually overheat the skin at all. Bai is saying, does Pico help redness, or would a different laser be needed? It could help a little bit with the redness, but usually I use XLV for that. That's usually what I use. Let's see, what do you recommend to correct severe eye bags? Really talk to us. We probably have to do probably have to do surgery if it's really severe. So we'll probably consider doing surgery. All right, guys, I appreciate you so much. I will see you again tomorrow night. So I'll see you again tomorrow night. So for African skin tone, people are asking still, that's what I was using right over there. I was using a laser. I'm one of the few practices in the country, probably in the world, that does as much in African skin tone, to be honest with you. Maybe a couple more that are out there, but I do a ton of it. And so I'm very, very happy in the amount of success that I've had with it. And skin and color, we could do an excellent job with it, making sure that it's very, very safe, and we get results that are going to stay with you and last. So it's awesome. I saw one more question. I'll hit this right there. What other treatments can you do for nevus of Oda other than Pico? We'll use a Q-switch laser, but Pico is really giving me the best option, honestly. But a Q-switch is okay too. Pico, Q-switch,